Hello and welcome to Professional Practice, What MRITs Need to Know, Part 1 of 3. Throughout this presentation, the acronym MRIT will be used for Medical Radiation and Imaging Technologist. This is the collective title for all specialties under the College of Medical Radiation and Imaging Technologists of Ontario. That is, radiographers, diagnostic medical sonographers, nuclear medicine and MRI technologists and radiation therapists. Let's begin. This presentation will introduce professionalism, regulation in Ontario, and the role of the CMRITO. We will begin by reviewing the concept of professionalism. What does the term professionalism mean to you? What is a professional? The literature identifies a professional as having three main components. These are holistic and are ingrained deeply into your personal qualities and values. They include your professional identity, or how you perceive yourself as a professional, your professional attitudes and ideals, and your professional behaviors. There is also a contextual concept of professionalism to consider. This is influenced by the workplace or organization, the environment you are in, and each specific encounter. As an example of how contextual factors influence professionalism, think about how you present yourself. Jeans and an old hoodie may be acceptable to wear on a construction site, however, they would not be considered professional attire in a business meeting or a job interview. Nonetheless, the true skill of a professional is often not about what you know or what you do, it's about how you do it. Building on the concept of professionalism, there are a number of core values that are common to all professionals. These are courtesy, fairness, honesty, integrity, respect, trustworthiness, and being ethical. You will notice that there are three more values shown here: competent, accountable, and collaborative. Registrants of the CMRITO are expected to hold these values under our standards of practice. We will discuss this in depth a bit later. How does professionalism relate to your practice of the profession? MRITs are accountable for patient care first and foremost. We are required to collaborate with coworkers and with other members of our patient's healthcare team to provide seamless care. These two factors will help manage the many risks involved with the provision of healthcare. For example, an MRIT reaches out to a nursing unit for information on their patient's condition. This helps them to prepare and adjust the procedure to meet the patient's needs. Knowing in advance that a patient requires a translator or is unable to ambulate will help the MRIT plan ahead and manage risks appropriately. In turn, this advanced planning and collaboration will automatically improve the quality of care provided to the patient. Finally, with respect to health and safety, CMRITO registrants are responsible for protecting themselves, their patients, and any other individual who may be present, from unnecessary harm. Next, we will discuss regulation in Ontario and how healthcare regulation affects MRITs. Before we get too far into this presentation, it is important for you to know what regulation is all about. Regulation is an oversight system which is designed to protect the public. It does this by setting entry to practice standards for the profession, only allowing those who meet criteria to register and practice the profession, developing and enforcing standards of practice for the profession, ensuring the continuing competence of registered professionals, and addressing concerns from members of the public through a complaints and discipline process. All regulatory bodies in Ontario operate within this framework. These four items are considered the four cornerstones to regulation. There are several types of regulation: government-run licensing, which is mandatory and administered by the government, like the requirement to maintain an Ontario driver's license if you want to drive. Certification and/or accreditation, for example, an educational institution may want to become accredited because it adds validity to their program and may promote enrollment. These could be voluntary or mandatory. And then there is self-regulation, where the government entrusts a profession with the task of regulating itself. Self-regulation is an exceptional privilege granted to some professions to regulate their own practice. The authority to regulate is delegated from government, usually by a statute or law. For example, the CMRITO is able to regulate itself because of a piece of legislation called the Regulated Health Professions Act, RHPA. Self-regulation trusts that as professionals, registrants are able to put their personal interests aside, and put their patients' care and interests first. Let's look at how the laws in Ontario are set up to regulate health professionals. The Regulated Health Professions Act, or RHPA, is the main legislation that governs 26 health professions in Ontario. It also sets out 14 controlled acts that are deemed too dangerous to be performed by the general public. These 14 acts may only be performed by regulated health professionals who are authorized under legislation to do so. Each profession has their own profession-specific act which defines their scope of practice and in some cases, gives them the authority to perform some of the controlled acts. For example, the Medical Radiation and Imaging Technology Act defines the scope of practice for MRITs and also authorizes MRITs to perform 5 of the 14 controlled acts. We'll talk about those a little later. The RHPA model was designed to be adaptable and evolve as the scopes of practice of the various professions evolve. There are also regulations that govern our profession. Some of these are under the RHPA and the MRIT Act, but others are separate laws altogether. These regulations set the college's registration processes, professional conduct expectations, and quality assurance program requirements. Many regulations are common to all regulated health professions with small differences from college to college. Finally, bylaws are the rules that govern exactly how a regulatory college operates. Government legislation authorizes a council to make bylaws related to the college's governance, administration, and regulatory functions. CMRITO council and committees are made up of registrants of the profession as well as members of the public. That is, registrants and council members sit on council and committees to create the CMRITO bylaws and administrative policies. There are 26 health professions in Ontario that are governed under the RHPA and regulated by 24 regulatory colleges. Here is the list of them. As mentioned before, under the MRIT Act, the scope of practice statement states that the practice of medical radiation and imaging technology is the use of ionizing radiation, electromagnetism, sound waves, and other prescribed forms of energy for the purposes of diagnostic and therapeutic procedures, the evaluation of images and data relating to the procedures and the assessment of the individual before, during and after the procedures. It is easy to see how this one scope of practice statement can represent all 5 specialties under the CMRITO. The MRIT Act also defines which controlled acts from the RHPA are authorized to MRITs. These include administering a substance by injection or inhalation such as the injection of contrast media, tracheal suctioning of a tracheostomy, administering contrast media, or putting an instrument, hand or finger beyond the opening of the urethra, beyond the labia majora, beyond the anal verge, or into an artificial opening into the body. Examples of these authorized acts include barium enemas, inserting a urinary catheter or doing transvaginal ultrasounds. Another act is performing a procedure on tissue below the dermis. An example of this would be establishing a saline lock, tattooing in radiation therapy or taking a blood sample. Finally, we have applying a prescribed form of energy. This refers to applying sound waves for ultrasound or electromagnetism for MRI. The application of other forms of energy used in other specialties of medical radiation and imaging technology is governed by other legislation. For example, the application of X-rays is governed by the HARP Act, and the use of nuclear substances is governed by the Nuclear Safety and Control Act. Ionizing radiation and radioactive materials are not regulated under the RHPA or the MRIT Act. The MRIT's authorization to apply X-rays to humans comes from the Healing Arts Radiation Protection Act, or HARP Act. The administration of radioactive material used in the practice of nuclear medicine and radiation therapy is regulated by the Nuclear Safety Control Act. X-rays are regulated through the HARP Act in Ontario. It sets out who can operate or apply X-rays to humans. This includes MRITs, physicians, dental surgeons, chiropodists, chiropractors, and dental hygienists. The HARP Act also sets out who can order X-ray exams. This includes physicians, dental surgeons, chiropodists, chiropractors, and nurse practitioners. Registrants of CMRITO are authorized to perform those 5 controlled acts from the RHPA as long as it is in the course of engaging in the practice of medical radiation and imaging technology. If you use performing a procedure on tissue below the dermis as an example here, MRITs may set up an IV as part of a medical imaging protocol, but are not permitted to perform medical aesthetic Botox injections because that is not part of the practice of medical radiation and imaging technology. MRITs must also have the knowledge, skills, and judgment to perform the act and manage any outcomes. An appropriate order must be in place authorizing performance of the procedure. Sometimes this is called a requisition. An order must be in place for performing any and all of the 5 controlled acts. Finally, MRITs must only act subject to terms, conditions, and limitations imposed on their certificate of registration. What is a prescribed form of energy? Who can order this and who can apply it? This chart shows the forms of energy relevant to MRITs in Ontario. Just a reminder that a prescribed form of energy does not include X-rays. This is governed under a different piece of legislation, the HARP Act. The RHPA refers to electromagnetism, sound waves, and electricity. Under the RHPA, the controlled act of applying or ordering the application of a form of energy prescribed by the regulations under this Act is partially allowed to be performed by MRITs as outlined in the MRIT Act. If you look to the MRIT Act, you will notice that MRITs only have a portion of this controlled act authorized to them, that of applying a prescribed form of energy. To be clear, MRITs can apply but not order the application of a form of energy prescribed by the regulations. More detail can be found in the CMRITO publication, What You Must Know About Performing Procedures, where you will find detailed charts related to who has the authority to order and apply prescribed forms of energy. This final section will talk more about the College of Medical Radiation and Imaging Technologists of Ontario. The CMRITO is the regulatory, or licensing body for MRITs in Ontario. In order to practice medical radiation and imaging technology legally in Ontario, you must be registered with the CMRITO. CMRITO regulates the activities of registrants in accordance with Ontario regulations. As a professional, you have the knowledge, skill, and judgment to do the job. But you also have a legal obligation to register with the college and to uphold the standards of the profession. As a regulator, CMRITO is charged with upholding the entry to practice requirements of the profession and developing the standards of practice that guide the profession. We also assist you in meeting your obligations for continuing competence, and provide a means for the public to ensure that the care they received, and professional conduct of registrants, is acceptable. Both you as a professional, and the CMRITO as the regulator, uphold accountability to the public and ensure public safety. Once you begin your practice, there are several organizations that you may belong to. Let's review the differences between them. CMRITO is the regulatory body for our profession in Ontario. Registration is mandatory as it provides you with your license to practice, and its mandate is to protect the public. You cannot work as a radiographer, diagnostic medical sonographer, nuclear medicine or MRI technologist, or radiation therapist in Ontario without first being registered with CMRITO. OAMRS is the provincial association operating in Ontario. The OAMRS lobbies the provincial government on important matters affecting the practice of the profession. They also offer CE courses, are advocates for the profession, and provide professional liability insurance. Membership is voluntary. CMRT is the national association responsible for administering the certification exams required to become registered with the CMRITO for radiography, nuclear medicine, MRI, and radiation therapy. They also offer CE courses, are advocates for the profession, and provide professional liability insurance. Membership is voluntary. Sonography Canada is the national association responsible for administering the certification exams required to become registered with the CMRITO in diagnostic medical sonography. Membership is also voluntary, and the privileges of membership are very similar to the CMRT. The CMRITO issues certificates of registration in 5 specialties: radiography, nuclear medicine, diagnostic medical sonography, radiation therapy, and magnetic resonance imaging, or MRI. Each of these specialties are under one professional umbrella, Medical Radiation and Imaging Technologists, or MRITs. A mission is a statement of organizational purpose and reflects the core mandate as set out in legislation. The mission of the college is to regulate the profession of medical radiation and imaging technology to serve and protect the public interest. Our vision is that CMRITO proactively regulates in the public interest with MRITs and system partners. Our core values are integrity, inclusion, diversity, equity, and accessibility, trustworthiness, transparency, professionalism, and respect. Within the college there are 7 committees, along with the council, that are required by the RHPA. These are Executive, Registration, Quality Assurance, Patient Relations, Inquiries, Complaints and Reports, Discipline, and Fitness to Practice. Committees along with their supporting staff carry out the work of regulating the profession. We have covered a great deal in this first presentation, including a brief introduction to professionalism, healthcare regulation in Ontario, and the role of the CMRITO. Please join us for part 2 of this presentation series, where we will review the CMRITO standards of practice, principles of communication, and preventing sexual abuse. Thank you for your attention. For more information on any of the topics covered in this presentation, please visit our website or contact us with your questions.